Okay. So this is me, Dr. Tamanna, and Dr. Tahir is also here. He will tell you about his experience and important points regarding AKP exam. Okay.
Yeah, first of all, a small introduction about myself. I am Dr. Tahir Hayat. I did FCPS from Pakistan, and I did my Part 1, Part 2 MRCPCH. Just waiting since maybe more than 2 years for the clinicals. And I'm working in a university hospital here in Pakistan in pediatrics. Almost 9 years of teaching experience in pediatrics. And this is for the first time I'm just joined by Dr. Tamanna, and it's really a pleasure to be with her. She is a great teacher. I myself learned a lot from her, and it's really an honor to be with her. This is just an introductory session. Shared, as she said, between me and her. And at the end, we can...
They did not divide it like for part A, this one, part B, this one. No. So the syllabus is like every system, 12 system, 14 system is there. Cardiovascular, respiratory, from emergency pediatrics, then poisoning. Every chapter is there like part 1. Okay, same chapters, but the question here are extensive. Big question, scenario-based question, problem-based question. Okay. And exam is 3 sessions per year, as you know, January session, May session, and September session. And in this COVID situation, exam is going on. I mean, there is no stoppage of part 1 and part 2, but only stoppage is clinical. So you don't have to worry about if you miss any session, like you can't give May session, don't worry, you can give September session. Okay. Take your preparation very well. So this is the website, RCPCH website. Fees you have to understand from there, because fees are changing. So like 550 pounds sometimes, and sometimes it may vary. Okay. Okay, Dr. Tahir, you have to say anything now?
Yeah, I mean, that is really important what she said about the timing. Especially, I mean, when you come across the first page of the screen on your paper, you will see, oh, only 55 questions, nothing. But once you sit for that, they are really time consuming. Especially, you need to solve them. The stems are really big. And sometimes the stem is so big that even you forget it and you need to read it again and again.
Yes,
So,
exactly.
Yeah, that's really important. And the gap in between the exams are really short. I don't know, some of you might be from India. It's really good that you have a station over there in your country. But for us, I mean, it's really difficult because there was no center for us. I appeared for my part 2 from Kuala Lumpur and for my part 1 from Doha, Qatar. So it was, I mean, financially a bit difficult as well. And there is extra stress upon you, that of traveling. Dr. Tamanna might know, because there is also no center for her.
Yeah.
So
I went to 2 times in India, and the traveling, it was very exhausting. And before exam time, I got my migraine attack. So this was very actually a difficult exam for me, part 1 and AKP both. But inshallah, now the students are giving exam. Alhamdulillah, they are giving exam at home. So this is very good. But some students complained me about the online, the invigilator, so they could not connect with it, and the exam was stopped. So it was also a hassle for them. But anyway, you have to be so prepared that whenever you see any question, you can understand the question better. And as Dr. Tahir said, that sometimes the question is so big that you have to read it repeatedly. I mean, you have to know the key points. You can take your one pencil, but you cannot you cannot you can make some points on your rough paper. There is a rough paper they will give you. You can make some points that this question has this point, but it is very time consuming actually. Okay. So the applied knowledge in practice, that is called AKP. You know, it comprises 2 paper and it will happen in the same day, and pass mark will be combined. And the AKP is different than the part 1 is that AKP that has more data interpretation, like, you know, datas of Cushing syndrome, datas of congenital adrenal hyperplasia, datas of diabetic ketoacidosis. They will give you a lot of data, and you have to know the investigation very well, that which investigation is indicating the disease. Okay, clinical photographs will be there, and I will advise you that this photograph, you have to be very sharp. I mean, your eyes should be very sharp. How to differentiate between a cigarette burn and an that is called, you know, impetigo, that is localized impetigo. How you have to differentiate, because this both the thing is circular. Localized impetigo is circular and cigarette burn is also circular. So how you will differentiate that this is impetigo or this is, see, if it is impetigo, there will be a history of upper respiratory infection or cough and cold, fever, like this. But if it is a cigarette burn, the child is completely healthy. There will be no history of previous illness, and the sibs are also okay. But you will find that the child is dirty, disheveled. I mean, there is a signs of neglect. Okay, there is a stepfather or stepmother. So this is a indication, I mean, this is a direction that the question is saying that this is a non-accidental injury, this is not a impetigo contagiosa. So this type of photograph will come, and the questions, you have to understand what is the key point, how you will diagnose. So this is a clinical photograph question. They will give you a photograph and a scenario. From that scenario, you have to understand diagnosis. Sometimes they will give you two diagnoses. I mean, what is the differential diagnosis? So you have to give 2 answers. Okay, radiology, imaging, and X-ray. This is very, very important. And I must say, the people who are non-trainee, I mean, they are not doing any training, they are not going to hospital so much. I mean, or they are doing only outdoor practice, they're not seeing patients so much. For them, radiology imaging is a very, very tough topic. And for us, like, we already passed FCPS, there was radiology topic in our FCPS, and Dr. Tahir is here, very knowledgeable person for this topic. So he will take the class of radiology and imaging, and you have to know the tricks, from where you can see posterior rib fracture, from where you can see CCAM, from how you have to differentiate this is a congenital bulla or this is a pneumonia. What is the difference between pneumatococcus and pneumonia? Okay, consolidation. So these things are very difficult by reading only books. Okay, these basic points, like, you know, key points for diagnosing an X-ray, this you should know from a learned person. Okay, and CT scan, MRI, ECG, EEG, also cardiac catheterization. These are highly specified topics, and there is usually 1 CT scan or MRI, 2 ECG usually there will be, and 1 EEG will be there, and 1 cardiac cath, also pedigree will be there. Okay, cardiac catheterization report they will give you. So for AKP exam, basically this is a clinical exam. There will be no basic question, only clinical oriented question. They will give you problem and a photograph of anything, X-ray, CT scan, MRI, and seeing the photograph and looking at the scenario, you have to understand the diagnosis. Okay, now each
Uh,
question.
uh,
Yes, yes, please.
I'm sorry. I think the very best thing about this AKP is that you always think that you are sitting in your OPD or you're sitting in your ER and you're receiving a patient.
Yeah,
And this is the history which is given to you. So what do you think? Always think with this frame of mind, it really helps. Like, for example, there is a history of a DK patient which is given to you. And at the end, they are asking what you're going to do. So
yeah,
you just think that I'm sitting in my ER and I have received this patient with these problems. So what will I do in my ER? So
yeah.
anyone who has worked in pediatrics, I think it will be really easy for them. AKP for me is easy as compared to the part 1.
Part 1, yeah, definitely. Part 1 was the baseline, and I also tell my students, part 1 is 80% already you done study. Okay, for 10% is AKP and 10% is clinical. But even then, AKP is also not easy for them who are not done so well in part 1. I mean, they just studied and by chance they got pass. So in that cases, their AKP will also be jeopardized. Okay, because they are not so good at clinical and not so good at theory also. So in that case, the AKP will be jeopardized. Okay, so the thing is, what I'm going to say, that you need a planned, structured course material, and you need a structured approach of studying and giving the exam. Okay, this is the main point. So now each question will be a case history. So there is a scenario based, I already told you. There will be a physical examination finding. I mean, on examination, what is this? You find like this, and some investigation they will give you. And trust me, this investigation will be like at least 20 investigation. They will give you like everything, CBC, neutrophil, CRP, liver function, renal function, everything they will give you. So from looking at that data, what is the question is suggesting is very difficult. Okay, so the investigation they will give you, examination they will give you, and history they will give you. And the AKP is actually your ability to test that you can diagnose a patient from the history and investigation and examination. You can diagnose and you can give baseline management. Now they will never ask you what is the treatment of acute leukemic leukemia, what is the treatment of brain tumor, what is the treatment of the specific disease, what is the treatment of super specialist treatment. They will not give you this thing. They want a safe doctor, that you can give basic management. Like a shock patient, you can give fluid. A hypoxic patient, you can give oxygen. A patient in pain, you can give morphine. So this is basic for management, is for registrar level. Then this MRCPCH actually for the registrar level exam. This is not a consultant level exam, membership exam. So AKP means the basic management. You have to understand the basic. Okay, now next.
Yeah, one more thing I would like to add on this slide,
Yeah.
that yes, AKP is a bit easy as compared to the part one regarding the study wise, but believe me, it's more tricky than part one. Why? Because in part one, like they will ask you that, let's suppose, what is IL-2 interleukin 2 inhibitors. So if
Yeah.
you know, that's it. If you don't know, I mean, it's on your knowledge based. It's all a rata sort of thing. But when you talk of AKP is all technical things. I mean, you need to think more. You need to use your gray cells. You might think that it can be that thing, it can be that thing. So you need to differentiate between multiple differentials. And as Dr. Tamanna said, that they want you to see a safe doctor. That let's suppose there is a case given to you, there are 5 differentials. Now they want to see which of these 5 you are going to pick. Like let's suppose there is a fever with fits, and you think that it can be a febrile seizure, you think it can be meningitis, you think it can be encephalitis. But at least they want to make sure that you're a safe doctor. What is your first step you will do? So they will not ask for something really special, some fancy diagnosis, but they would like to see at your level that you don't miss meningitis at least.
Yes. Yes.
So I mean, they just want safe doctors, as she said.
Yeah, exactly. Like suppose a patient came with you with a PTCL rash and you discharge without any investigation or without anything. That will be a disaster, because this patient may be meningococcal meningitis, and maybe this patient is the what is that PTC differential diagnosis. It can be sepsis. Okay, so the patient will be jeopardized, or his life will be in danger if you does just discharge. So you will be a safe doctor. You will admit the patient for 4 to 6 hours observation, and then you will do some basic investigation like CBC, CRP, then renal function test to rule out your basic PTC, Parpura, and you can do clotting factor study. So these things are very technical. Okay, these guidelines are very technical, and we people like me and Dr. Tahir, we read pediatric and neonatal guideline at least 10 times. More than that, I read more than that, because I'm doing every day my part 1 batch. So you have to be on the fingertips, this guideline on the fingertips, so that when any question comes, what is the first management of hypoglycemia, Now, hypoglycemia is different for different child. For neonate, it is different. For pediatric, it is different. For diabetic child, it is different. For MEMCARD child, like medium chain triglyceride deficiency, that is hypoglycemia management is different. Now, these things a junior level student will not understand. So if someone guides you towards a pathway that this type of hyperglycemia will come in exam, so you can focus on that topic of the guideline. Okay, that is my main point, that why we are doing this course. Why? Because we like to guide you to a center point, that this is the center of the question. The question will come from this topic and from this scenario. Okay, so I will suggest you, please take preparation for 5 to 6 months. Don't rush. Maybe you are doing very good in your ward, you feel confident, but don't rush. Give exam within 5 to 6 months time. Then take a good preparation, read all the x-ray, read all the ECG, EEG, that's important for AKP, and then go to the exam hall, pass, and then go to the clinical. You will feel a lot of good insight. So resources are very, very long list. Like when I started preparation, I had at least 20 books print out. I have now these books. 20 books I printed out for AKP. Believe me, the 20 books I opened. First 2 or 3 months I was puzzled, which is important, what I should keep, what I should discard. Then gradually, slowly I became organized, and with my partners, with my reading partners, with my friends, we became concentrated on a specific topic, and we made notes that what is important for us. That notes are very helpful for me now, because when I can teach you, I feel the confidence that yes, those notes definitely will help my students. Okay, so again in AKP I read Fopentas clinical cases book, also the 50 cases book for AKP. These 3 cases book are released from the RCPCH. Okay, they made these 3 books, and these 3 books are very, very good. I still read them. I still love these 3 books, because each case is a system. Like there is a skin system, there is a CVS, respiratory, cardiovascular, gastrointestinal, endocrine. Each case is a system based question, and each case, if you read each case and then read that system, endocrine system suppose, or cardiovascular, then your preparation is complete regarding that system. So you have to read again the Fopentas clinical cases book, also AKP cases book. Survival guide, we already read few chapters in our part 1, and now you have to read every chapter for AKP. And this survival guide is very good book, and Dr. Tahir will take this class. Dr. Tahir, you want to say about something, survival guide?
Yeah, I mean, they used to say that if you want to survive in pediatrics, you need to have a survival guide on your fingertips. So it's really important. I mean, uh, uh, pediatrics is a very vast field. It's I think more difficult than general medicine. Because it's so vast. Now they are categorizing it into different specialties, and every specialty itself is such a big thing. So there are a lot of books in the market. You cannot read each and every one, and every book cannot give you a perfect overall glance. But I mean, this survival guide, the good thing about it that I think I have read it more than, to be honest, maybe more than 30, 40 times, really. Why? Because I have read Nelson, I have read all the good textbooks, the current, the everyone. But this book, it gives you the basics, the basic, I mean, which you need to know to survive in pediatrics. And believe me, now even in clinics, when I'm sitting around, I just open this book and I refresh my knowledge. And there will be only a single sentence, and there will be hell of a knowledge in that single sentence. And the good thing is that these AKP papers, I think someone, if read this book 3-4 times, I think that will be enough for him. With some good guidance and all that, I think he'll really easily do that.
Survival guide is actually a gist. There is no single line unimportant. I mean, every line it has some information that Dr. Tahir said. Especially why I like this book, because this book, the writer of this book, they know that how to start from the introduction and go to the end. and which investigation and which test is important for that particular system. Okay, like gastrointestinal, I can say when I was, sorry, anyone talking? So from this, when I was reading the gastrointestinal chapter, I saw there were tests to do intrinsic factor deficiency and how you will do test for vitamin B12 deficiency and intrinsic factor deficiency. I really was surprised that I read Nelson, I read many books, but it was so easy to understand the test, and it was a very difficult test. So easy to understand the test. So each and every test, I wish the writer could, upgrade it to a higher level, because this is such a good book. I wish that the writer know that how good this book is, and he should add more chapter and he should make it volume. Like, it is a very short book. So this book is basically very important, as Dr. Tahir said, and Dr. Tahir will take this class because he is expert in this book, and I will take the clinical cases class because I am expert in that book. And now new format book is very good for me. Why? Because new format book is a real question based book. It is an MCQ book. You will know how the clinical scenario is coming, and how it is matching with the answer. Okay, in the new format book there is multiple answer question. I mean, one single question and 2-3 answer. So it will be your practice that how to answer 2-3 stem. Okay, and new format book has X-ray, ECG, data, so everything is compact in a new format book. So I will take this class because I had read this book at least 10 times when I was a student of AKP. This was my favorite book, this was. So new format book will be your main book as MCQ. Like, okay, for AKP we don't read so much on exam, AKP mane past paper. Like part 1 we did on exam, we did past test, question bank. But for AKP, I think new format book will be half of the preparation. Okay, rest of the study, like, you can do from survival guide, clinical cases book, FOB, TAS, and AKP. In my AKP exam, there was question from FOB book. I got a direct question, that is a morphine question from the FOB book. Okay, so that means the question from FOB and TAS clinical cases, especially the FOB book, you will get in AKP. So you have to revise it again. The people who already passed part 1, for them this is nothing. You just revise it one more time. And this book, like towards MRCPCH part 2 book, 250 question book, these are very good book for data interpretation. You can read them when you are lying ideally, just idle, you have no mood for study. You can look at the question pattern by opening this book. But one thing is that these books are very old, like 250 question and towards, they're very old book. So if you see the management, there is some change. There is some change of management of these two books. They are, I think, 20 years back book, 250 question and towards. So basically, you read this book, but don't take the management portion and investigation portion. But the basic, like understanding a disease, pathophysiology of a disease, these two books are good. Okay. And the radiology book for MRCPCH and FRCR, this is a very, very good book. Okay, I personally love that book. This book has around hundreds X-ray and CT scan, MRIs. Okay, so this book is very elaborated for radiology. If you read this book, I can tell you that when you will be registrar, okay, under you there will be many trainees. You will not miss the important diagnosis, at least. Okay, I'm not telling that you will be super specialist for radiologists, but at least this book is important for daily practice. And Dr. Tahir will tell you something about these radiology chapters. Dr. Tahir?
Yeah, as he said, this is one of the best book in my library, actually. And I have read it several times, and believe me, it's an excellent book. I think better is to get this book rather than to get the soft copy, because in soft copy, I think the pictures might not be that clear. And there are, I think, 100+ cases in it. And these are the most I mean, Dr. Tamanna, as a clinician, I am personally a clinician working in pediatrics for so many years. I think we see most of these cases repeated again and again in our general practice, and the same things you usually get in your exams. Um, I think this book is more than enough, especially with such a beautiful elaboration. There is actually a case given to you, then there is a picture, and then there is explanation, how you explain that x-ray, what is the diagnosis, and then something about that diagnosis. For example, if there is an MRI scan which says that there is an abscess in the brain, then they have explained that what you see in CT scan, then they talk about something about that topic, the brain abscess, its management. So I think it's a very compact sort of book.
Yeah.
uh, it's a very good book.
Yeah, and one thing is that not only reading will help you, but how you will differentiate between the bula and the sikkim. These things maybe not you will not find in the book. These things you will be taught by Dr. Tahir. How we will differentiate, because sometimes the X-ray pictures are similar, okay, similar to multiple diagnosis. So how you will know that this is not CCAM, this is actually congenital bulla, or this is pneumatocyl? How you will differentiate between these two things? Like I told you that the impetigo and cigarette burn, what is the difference between impetigo and cigarette burn? See, impetigo margins where will be very irregular, and in impetigo there will be honey colored crust, but in cigarette burn margins will be very regular, there will be no honey colored crust. This is only one point I told you. See how now if you see this picture in the Google, you will understand very rapidly, yes, what she told was right. Okay, so these tricks and tips you need to pass the exam, trust me. Some students failed in AKP and messaged me, Madam, I failed, Madam, I failed. And I felt very, very sorry, because I could not teach them, because some techniques are very, very easy, but someone must be there to guide you, to catch you that techniques. Okay, like we have experience. For me, I am doing teaching part one, extensive teaching. I have the maximum number of students in the whole world for part one. I can say that because I took the data from different batches. So by this experience, I can tell you that these tips and these tricks, it will be help in passing. You will definitely pass easily. Okay, and then there will be no waste of your fees, because fees is huge, 550 pounds. This is a huge amount of money, and some students have to travel. That is another extra money. So I will say, don't take the chance by chance, don't take it. Do preparation well. If you can alone, more than welcome. If you need our help, more than welcome. Okay, so pediatric radiology, as Dr. Tahir said, he will guide you some important points that you can understand easily, and you can match, you have to match with the clinical scenario with this X-ray. So Dr. Tahir will tell you how to match the clinical scenario with the X-ray, with the CT scan. Okay, then this also book, 125 question and clinical photograph. This is also an old book, as I told you. These books are basically, I will not recommend you to read, but you have to know that, okay, this type of question comes in exam. Get through book. This is also a very old book, 20 years back. Get through for MRCPCH. This is a data interpretation book, and it is a beautiful book. But the problem is now the management is changed. Investigation is changed. 20 years is a lot of time. So that's why you cannot take the management portion from these books, okay? But you can read the scenario. As I said before, that photos you have to study from Google. Not only part AKP, but in clinical also. When you will do clinical video station, you have to see pictures from the Google. You have to see video station from the YouTube. So Google and YouTube are the best teachers. I will never say that Google and YouTube is not a good teacher. Of course, it is a very good teacher. You have to see photos. I mean, as much as you can, cigarette burn, as much as you can, see the CCAM, see the bulla, see the pneumatocyl X-ray, as much as you can. Look at the difference. What is the difference with pneumatocyl and, this congenital bullas? What is the difference? So you have to look Google photos and YouTube videos. These are very helpful. Pediatric guideline, neonate and neonatal guideline, these two books, Red Book and Blue Book. The latest edition is Red Book and Blue Book. You have to know each and every topic very by heart. I mean, the management of neonatal sepsis, what is the first line drug, what is the second line drug, if the person is penicillin allergy, what drug I will give, if the child has MRSA, what drug I will give, okay, how I will monitor vancomycin, gentamicin in a neonate. These guidelines are more than important. Any book is not important like guidelines. For part 1, part 2 and clinical, only book that you have to read these three part of exam, that is the guideline. So pediatric guideline, neonatal guideline, again this class I will take because already I am teaching these guidelines. So the guideline, I will teach you the tricks and tips of AKP question, not part 1. Part 1 I already teach you. So now I will tell you that what type of question will come from the AKP, question, okay? So these guideline books are very important. Dr. Mustafa Al Baba has some notes, sheets, okay? I personally modified this sheet and I did adding some points. So I will teach you those sheets from important point. These sheets are nothing but the combination of X-ray, ECG, EEG datas. Okay, scenario. These are combined sheets. So I will teach you that how you will answer data, how you will answer reading, matching a scenario with a data. Okay. Nice guidelines. There are some guidelines that are not present in our guideline book, like that is called MCARD, management of MCARD with hypoglycemia. Then refeeding syndrome, that question came in my AKP, refeeding, management of refeeding syndrome. So there are some special guidelines, Crohn's disease guideline, okay? There are some special guidelines that is not present in this red book and blue book. So you have to know which guideline is not present, which guideline I have to read. Okay, there are at least thousands and thousands of guidelines in NHS. You cannot read them all. So which guideline is important for AKP? This thing you have to understand. Okay. Now, past test question bank for AKP online subscription, you can take past test or on exam, but as I said, these are not so helpful in AKP. Okay, you can do as a practice, but it will not help you in understanding the basic point, and it will not help you in passing the exam. So some people, do only past test and they pass the exam. Dr. Maywish, your mic is open. Okay, please be careful. Okay. Okay, now sample paper, as I said, sample paper is very important. Sample papers are direct questions from our CPCH. They give before the exam date, and those are collected in some folder, and we don't teach this sample paper in our class, but if you have any problem, you can discuss with our group if you have any problem with sample paper, because sample paper answer is already given, explanation is already given. That's why we don't teach it sample paper or past test, but we discuss in recall in our class. Okay, in every batch I discuss recall question, how to answer recall question. There is some technique in reading recall. Okay, you just can't see it and answer, read the wrong answer, because most of the recall answers are wrong. Because I gave exam, suppose I did some mistake and I tell my juniors that this question came and this I gave this answer, but actually the answer is wrong. So recall has many wrong answer. So if you are guided by a good teacher, they can teach you that this is wrong answer. They can, point you out. Okay. Dr. Tahir, you have to say anything about recall or...
Yeah, especially regarding this slide, one or two things. Number first is that what Dr. Tamanna said, that the guidelines, especially the red book, the blue book, the green book, a few topics from the green books. So these are really important. Why? Because these are based on the UK practice. And you need to produce the knowledge according to the UK practice. Like, for example, the first line drug, let's suppose they ask you a scenario that this is a sepsis, which drug you will give. Now, maybe you're working in India, Bangladesh, or Middle East, or anywhere, Pakistan. The practice is different for everywhere, but you need to produce the UK drugs, what they are following. I mean, this is really important. That's why most of the people here in Pakistan, they have done FCPS, they have done hell of a practice, but they go to exam and they fail. Why? because they think that we have studied Nelson, we know the basic things in our practice. They just go there and they answer that thing, but they fail. Why? Because they don't know about the UK system. So these
Yeah,
books are really important. And the other thing, as Dr. Tamanna said regarding these recall questions, I think more than 50% are wrong.
yeah,
And I made notes for myself. Every one of us, I think they have their own notes. Like maybe Dr. Tamanna has her own, so we can share that. And it's important not to follow them blindly. It's just to take an idea out of that,
yeah.
not to follow them.
Exactly. You have to take an idea from the recall, but you cannot follow them because the answer may be wrong. Okay. Okay. So next is our topic is, so how you will start your preparation. Okay. This is my experience, how I started. I started with the survival guide, as Dr. Tahir said, and I read it 2-3 times, and then I read photo from the Googles, and I again read the guidelines, red book and neonatal book, blue book, and I read statistics, ethics, safeguarding from the NHS guideline and from my part 1 experience. Ethics is very important. You know, there is a book, Everyday Medical Ethics, and that has a pediatric chapter, pediatric related chapter at least 1 or 2 times. Then there are some other books like written and practice exam book. These two books are very popular because they have problem based question, like they have scenario on examination and investigation. Okay, so you can follow these two books. I read personally these two books, I mean 2 to 3 times I read. It was a very good book. I find it, written exam, practice exam are very good book, especially the investigation and investigation portion. I mean, if you diagnose Crohn's disease, what to investigation is most important. If you diagnose iron deficiency anemia, what will be the picture of ferritin and TIBC, what will be the relation with these investigations. So this written exam and practice exam, I find it very useful for investigation purpose. And radiology books, we already discussed. And sometimes in exam, like in my exam, the x-ray, chest x-ray was normal. I did not find anything really. Then I look very carefully at a very, like I zoom the picture in the computer. There is option, you can zoom, okay? So I zoom the picture in the computer. Then I look like my nose was touching the computer. Literally, my nose was touching the screen. And then I looked, why? What is the problem with this X-ray? And then I find there is a tiny fracture in the posterior rib. Okay, two fracture, tiny, very tiny in the third and fourth rib. Then I guess, okay, so this is non-accidental injury. So, and that time I gave the answer non-accidental injury, and my AKP number was very high, like 83-84%. So and in the respiratory I got 100%. That means that answer was correct. So the X-ray will be very, minimum amount of finding. You cannot expect that it will be very good amount of finding they will give you. No, they will give you minimum amount of finding. Okay, a tiny bulla you cannot see by your naked eye. Okay, you have to see the microscope. What is the bulla? Where is the bulla? Okay, a little bit of effusion in the cardiothoracic angle or in the costodiaphragmatic angle. So like is little bit of fluid they will give you. They will not give you a large crescentic shape of fluid. Okay, so that is the technique. That technique will be taught by us. Dr. Tahir is here, Dr. Ami is here. So that what type of X-ray will come in exam, how you should look, zoom the picture, how you should concentrate on the rib, on the muscle, on the vessel, how you should know. Some X-ray will be like pulmonary vessels are dilated, and the X-ray is hazy in the medial 2/3 of the chest X-ray. So this is a pulmonary edema, and so this type of X-rays are very important in AKP. Okay. Now, new format book, I already told you, this is a very important book. AKP cases book is important. And 250 cases book, written exam, then towards MRCPCH, these books are very old books. So I will not recommend you for long time study of this book. Okay. Okay, now advice and study plan, how you will do study. This is for the students who will do study alone. Okay, for our batch, our routine is different. we will make a routine, and Dr. Tahir and me will regularly take the class once in a week. So you will be in a track, like you cannot go without the track. You have to read the next class topic, okay, and you have to ask question in the class. So our our teaching session will be around 3 months. Within these 3 months your preparation will be completed, because every week there will be one class Dr. Tahir and one class by me. So you have to understand this topic before the class, and then we will teach you that topic in the class, and then after the class you will read 2 to 3 days that topic, so the topic is completed. So you will be on a track, okay, because it is important to discipline your study. Your study will go here right and left, right and left, but it is important to discipline it, okay. So as I said, that studying hard is the best method, but you have to study smart also, okay.
Uh,
Anyway, yeah,
Dr. Tamanna, excuse me. One thing I'd like to add on here, Dr. Tamanna, that we are not actually teachers. We are facilitators.
oh,
Because we are not going to teach you something. We are going to guide you. We are going to facilitate you. Like, for example, like let's suppose there is a question for you in your exam that is going in a favor of child abuse, and you get an x-ray, just as Dr. Tamanna said, in her real exam, and that x-ray is normal, and the age is under 2 years. He's a toddler, less than 3 years. Always and always think, even if the x-ray is clear, search for child abuse. I mean, these are the things, these are the tricks which really happen to us. And being teachers, teaching so many students at registrar and senior registrar levels, we practically come across these things. So we just will show you the shortcut and the
yes,
bottom
exactly.
line, that what is the bottom line and how you're going to fix something. We are not, because you all are doctors and you all are qualified senior doctors working in different pediatrics unit. So you might be having a very good and very sound knowledge, but
Yeah,
you need to focus on something, and we're going to guide you to focus on how to
yes.
focus on something.
Exactly, exactly. Dr. Tahir said very well point. I have some students that are associate professors. I am myself assistant professor, but I have students of associate professors. I mean, they're senior than me. But why they joined my part one batch? Because for the guidance. Okay, they said me that Tamanna, you are very junior to me, but I like your guide. I like your guidance. Okay, that's why I said, sir, don't enroll my batch. They said, no, 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 don't think that I am your senior, but we will get the guidance from you. So that is the main point of our course, and we are successfully completing part one course. I completed at least 200 students. I already completed teaching. That's a huge number of students, and those students, I don't know how much they got help from me, but I personally tried to teach or give my all the knowledge to them. Okay, it is not possible in 3 4 hours, but I try at least to give the basic knowledge, okay. So X-ray, ECG, EEG, I already told from books and Googles. You have to read. See, in the exam, the picture will not be so obvious. ECG, you cannot see right ventricular hypertrophy, left ventricular hypertrophy. It will be very tiny amount of change. Okay, like right bundle branch block, left bundle branch block. It will be very tiny amount of block. And the thing in Wpw syndrome, in my exam, I got a question of Wpw syndrome, and the delta wave was so faint. I hardly could understand. But I look at the QRS complex. It was a little bit broad. So I thought it cannot be supraventricular tachycardia because the QRS complex was a little bit broad. So I answered Wpw syndrome, and I got 100% in cardiology. That means the ECG was okay. My answer was okay. So you have to understand the basic points of ECG. What is the difference between WPW and SVT? I got a scenario of child who came with a shock, and the ECG was given. Now shock is common for both WPW and supraventricular tachycardia. Both shock is common. So what is the cause of this child shock? Okay, is it WPW? And the delta wave was very faint in only one lead. Only one lead there was a delta wave. Rest of the lead there was normal. So that is a tiny change it will come. So you have to be very, very expert in the scenario, in the matching the scenario with the ECG or with the EEG. Okay. Past exam and sample papers, as I said, these are vital. This will definitely only, you can get 30 to 40% question from the recall and sample paper. So these are very, very important. And for the past recall a question, identify the mistake. Okay, doing the right way is very important. So I will suggest you make a group of friends, 2 3 people or 4 5 people, not more than that. It will make a chaos. So make a small group and then study with each other. Okay, revise and revise many times, like AKP cases book, new format book, guideline books, practice exam, written exam, x-ray book, survival book. So minimum amount of books, but you have to read many times so that your knowledge is so sharp, your grip is so sharp in the scenario, clinical scenarios. Most of the AKP question will be scenario based. There will be data, there will be x-ray, ECG, okay, with a scenario. Without a scenario, there will be no question. See, a lot of study before the exam, this is very bad. Okay, study every day and revise it after few days. Okay, and keep your eye on timing, because you may think that 55 question is nothing, but this is a very, very important 55 question, maybe kill your a lot of time. Okay, statistics, now this is very important point. Statistics, AKP statistics is not same as part 1, and for the AKP statistics there is no book, only few questions from the sample paper. That is not enough. So we have a very good notes from these statistics, what type of question are coming from confidence interval, mean, like odds ratio, relative ratio, how you have to give answer, and the answer will be multiple, like 2 3 answer from each question. And this statistics question, at least 4 question will come, 4. So if you miss those 4 question, at least 16 to 20 mark you will miss. So this is a huge number. Okay, you cannot just discard statistics. Okay, the people who says that I will not answer, I will just answer A B C D something, no, you cannot do this, because the answers are easy. If you know the main question pattern from statistics, it will be very easy. Okay, pharma question, there is no special books for pharma AKP, but I made some notes during my time from the recall and from the part 1 question bank. So those will be helpful for you. Pharma, AKP pharma is not same as part 1 pharma. They will give you a scenario and they will give you what side effect you have to look for, how you will monitor the side effect. So this is a different pharma from part 1. Ethics and palliative, I always tell, there is my live in the Facebook group and YouTube channel. Ethics and palliative is a vital for MRCPCH. Even in the clinical exam, there will be one scenario for ethics or palliative. So like from the 9th station, 1 station you will get from ethics. This is a huge. So for part 1 and part 2 AKP also, you will get 4 to 5 question from ethics and 2 to 3 question from palliative. So at least 10 question you will get from these 2 chapters. 5 question from pharma, 3 to 4 question from statistics. Okay, so these last 4 chapters, like statistics, pharma, ethics and palliative, these last 4 chapters you will get at least 20 question. Okay, so this is huge. Yeah, Dr. Tahir.
Yeah, Dr. Tamanna, because this is an important point, I would just like to add. Few of my friends, they are working in UK currently, and they are working as senior registrar levels. They have a relation with their professors who are working in RCPCH, and they are making papers and all that. They told that the exam are basically they are percentile, the exam. It's not like that you corrected 4 questions and every question is carrying 4 marks and you got 16. No. Maybe one question is having 3 marks, maybe one is having 1 is having 2. So the important thing which he told us, that the ethics, they have more marks as compared to the other.
Yeah.
So if you get something wrong in ethics, so more marks will be deducted than you think. Maybe it cost you 2 questions. So
Yeah.
that's why we never know that which one carries how much marks.
Yes, exactly. Dr. Tahir said very well that not all the question will carry equal marks. Okay, the marks will be different. Okay. And so this is our next slide. Make your own notes. This is my part. Make your own notes. I always make notes because it helps me. Before the exam there is no time, so I give a short look, a quick look on my notes. And sub boxes I revise again, because sub boxes has, you know, metabolic chapter, ethical chapter, pharma chapter, so I revised again SOP, Science of Pediatrics book. And sample paper and past recall, don't leave it for the last week of exam. This is a mistake. You have to practice it from beginning. And in last 2 days, if you want to travel, book the hotel near the exam place. Why? Because so that in the exam day you are free from your, you know, you're free in mind. And take a light breakfast, because I felt sleepy when I took, you know, rice, and I felt sleepy because that was the breakfast actually I had. So that is my advice: took light breakfast at the exam day. And if you answered quickly, then don't leave the exam hall. Sit at the exam hall, look again of the flagged answer, take your time. And there is one point I would like to tell you, that first answer is the best answer. This is also my teachers, my senior says that what you think about the first time reading the question, that is the best answer. Okay, don't change your answer if you are not sure. Okay, so these are the books which we will highlight in our course. Also, I have some pedigree notes, ECG, then cardiac cath, EEG. Also, we will give share with you. So these notes, these books are main books. You have to print out these books for our course and for your study. So this MRCPCH has the highest postgraduate value actually in the UK, and you can work as a specialist in other countries for other parts of the world. In Bangladesh also, there is a huge value for MRCPCH. Okay. Now, if you have any question, Dr. Tahir, I'm sorry, I maybe shared not your one. Okay.
Yeah,
Dr.
it's
Tahir,
okay. I can just
yeah,
verbally say,
yeah.
like Dr. Tamanna, she has a very good feedback. I'll just like to add on that feedback that the training in pediatric matters for AKP. Like the one who has spent 5 years in pediatric unit, I think he will do better as compared to the one who has spent 2 years or 1 year. So this is an edge who is having more time spent in the pediatric unit, especially the teaching one. They will do a bit better. So they should be a bit more confident. The other thing is that, yeah, better to solve MCQs, but not randomly. That like you purchased an pass test and you're sitting from page 1 and you're going to the page 50, and you divide it on 30 days, that every day I'll be doing 20 MCQs and blah blah, and it'll finish in 30 days. No, I think it's really wrong thing. What you do, that you sit, turn the clock on, uh, uh, take a test, like there is a test on the RCPCH side, and finish that test in that 2 hours and 30 minutes, the same number of MCQs, and judge yourself that you're able to do that in that particular time or not. So this is called time management, and it's really important, because once you sit in the paper, especially this AKP paper, the stems are very lengthy and they are very difficult sometimes, and they're time consuming, and it's really tricky one sometimes. So you need to have an eye on the clock. And as she said, the notes, yeah, they're really important. You need to have a notes. uh, Senior opinion, it really matters. You need to take opinion from your seniors who appeared in the exam, who have cleared that. We have given our opinion. You might be having a circle of friends. You can take opinion from them as well. Um, for me, like we are the course provider, it doesn't sound really good, but I would like to say this because this is really important. I mean, it can help someone. There are a lot of courses in the market. I don't say that opt our one, but I think the crash course is really important. You can opt any good one. The reason is that you cannot sit and you can read everything. you need guidance, and that
Dr. Tahir,
guidance.
most of the point is one important point I will forget later on. That
Yeah.
is the courses for AKP. Most of the courses are Arabic. Okay, Arabic providers. So their English, they fluently speak Arabics. And when they try to understand you something in English, also some Arabics comes out. So that is the thing that English people like us, like Bangladesh, India, Pakistan, we don't speak Arabic at all. So for these countries and also UK people and like Nepal, Maldives, like the Sri Lankan, and so this continent people actually prefer our course because of this language barrier. There is a language barrier for us and with them. And our English is very, I think it is very easy to understand because we pronounce every single word. We don't have any accent. Okay,
Yeah, exactly.
it's easy to understand for every. I personally, I can tell you that my students are Arabic also, okay, Arabs, and they tell me that, madam, your English is okay. I mean, we can understand your English because your English is like a baseline level of English. It does not have accent like UK or USA or Australian accent. We don't have. So the thing is, language is a very important point. Okay, so choose a course that is nearly your language, nearly. So that is very important. Okay,
Yeah,
Dr.
yeah, indeed,
You can
that's
say
really
this,
important.
this slide, your slide. This was.
Yeah, yeah, that's one. Yeah. Um Thank you. So other thing is that because there is an evolving condition, COVID-19, we all are there. We always pray that this thing got finished quickly, because we are also stuck for the past 2 years, me and Dr. Tamanna, for this clinicals. I think the best thing is to go through the RCPCH site and go for this exam guideline section, because the guideline section, they have been changed for the COVID as well, and what we have discussed, I think you will get over there, and you might get something extra over there. So spare time and just read that. And the other thing, if you are appearing from your home through online exam, if you have opted that option, so in that case, I think you need to know their SOPs. They are really important, because your internet connection and your computer, your laptop, your background, your noise, these all things are really important. So you need to go through that SOPs. And before exam, that is really important, because it will guide you that which exam you want to be opted, like you
Yeah,
want to opt the online or you want to opt the physical presence one.
yeah, it's
Oh.
very important. Another slide, Dr. Tahir's slide, I'd like to share. Yeah, Dr. Tahir, this was your slide.
Yeah, this one almost we have discussed this slide. I think the last thing which was left, that is the self notes.
Yeah,
So for you guys, I think it might be difficult to make your self notes. It's very important that everyone should make its own self note. And at the end, last 1 or 2 weeks, I think you should only go through your self notes rather than going through your laptops, your books, and all that. It will create problem for you. You will be in trouble. Just make few notes and go through that. I have my own notes regarding the past solved questions, and also the I have made from different books. Maybe Dr. Tamanna has her own notes, so we can share that as well. You make your own, then you can share that with somebody else. They will be
yeah,
helped out. So
exactly.
it really make things really easy, because Dr. Tamanna, one thing I'll share over here, maybe I forget it. Um, in my exam, you cannot believe that 29 questions in
Hmm.
my AKP I had from my register, the notes
Oh,
which I made.
yeah.
When my paper finished, I was in Kuala Lumpur. My brother called me. What happened? I told him 29 questions I have just read last night. And
Oh,
this thing can happen to a lot of people. I mean, everyone would be having his own story. So I think it's really important to have your own notes. That is very important.
yeah, exactly. So yeah, this is the result card. Okay, result card you will get, like paper 1 you will get 1 number, paper 2 total mark, and this total mark they will make percentage. Okay, and the percentage of this one will vary. I mean, this is not fixed. Okay, this is not fixed. That time this was the percentage. Like in our time it was, I think, 65%. Sometime it will be like more or less, like this. Okay, so total mark was this 282 among 489. Now this 489 was also not fixed. Sometime it will be like 470, sometime it will be like 460, like this. So the question, they are dividing according to their rules, and they are making pass mark according to the graph. Suppose this is the graph, and this is the pattern of getting mark. Suppose this is the pattern of getting mark. I mean, most of the students got mark here. Suppose this is the 60% marks. Most of the student got peak. So they will arrange the pass mark according to this peak. Okay, so don't think about pass mark, or don't think about how many question, how many mark is there. You just give your exam. You just understand your exam pattern. It will be, I think, very helpful. Okay, don't waste time on this thing. Dr. Tahir, you have to say anything about this?
No, that's it. What you said, yeah, exactly the same.
Okay. Okay, so now let us, sorry, just 1 minute. I have to. এই হয়ে গেল, দেখো তো বাবা, এটা ই করো তো, কার্সারটা কোথায়? Okay, sorry for this technical problem. Okay, now let me share the next slide. So these are the books we already told you. Okay, so anyone has any question now? I think we're almost done. Okay, anyone has any question now? You can ask us because we are free now. Any question? Anyone can open mics and then share with us their experience or their expectation. There is some question in the
Dr. Tamanna, your mic is mute.
Okay, sorry, am I audible, Dr. Tahir, now?
Yeah, now you're audible. Yeah.
Okay, hello, am I audible to you?
Yes, you're audible. You're audible. Yeah.
Why wasn't a video online? Right, look, this is Rahil. Assalamu alaikum. I have a question actually. The book you showed on the slide, are these all for the part 1 only?
Sorry, our session is not for part 1 today. Our
Okay.
session is AP, not for part 1.
Okay, thank you.
Yeah, any question, any more question? Okay, the course started, will be, our plan is from the June, after the Ramadan. Okay, after Ramadan, because the Ramadan is coming now. So within first week of June we will start. And yeah, and also the books, actually the books soft copy will be present. All these books are present in my Telegram channel. So I am giving you the link here, my Telegram channel. You have to collect those books from my Telegram channel. I cannot share individually because this is wrong. Actually, this is illegal of providing these books to anyone, because the authors are not given permission to me. So actually I cannot distribute this book in general people. I give it to my students, of course, but for you people, if you join my Telegram channel, it will be good. This is my copy, this is my Telegram channel here. Okay, you will get all the books here. You just search the group, there is all the groups shared in the group. I cannot personally give you the book. Okay, this is wrong. Okay, in a group I can share, but I cannot personally distribute it. Okay, any more question from anyone? And our class will be once in a week, and Dr. Tahir will take class and I will take the class. As I'm running already part 1, it is very highly, saturated group. I have more than 50 students in my current batch, 55 actually. So I cannot give you much time for this every week, 2 class possible, not possible. So one class will be taken by Dr. Tahir and one class will be taken by me. And Dr. Tahir, I can say that he is better than me. I can tell you that he is better than me. I personally feel he is a very good professional doctor and a kind doctor, that he is ready for this course. How much question to expect on CT scan, MRI, clinical photograph? This is not fixed. Okay, you will get 2 CT scan. One CT scan, 2 or 3 X-ray, 2 ECG, maybe 1 MRI, clinical photograph maybe 5 and 6, ECG 2, EEG maybe 1, and cath maybe 1, pedigree maybe 1. This is not fixed. Okay. And when your AKP course is starting, I have June first week. Okay, we will start June first week. And when is your course starting? Is this for September? Yeah, this is for September batch. This is not for May batch. Madam, where can we find the written practice exam? You can search on my Telegram channel. And please guide about books for part 1. Sorry, this session is not for part 1. For part 1, you can look after my YouTube channel. Okay, there are lots of free meetings. I did recently one meeting few days back. So for part 1 session, you can look at my YouTube channel. And my YouTube channel, I can give you the link of my YouTube channel. Just give me one more time. Dr. Tahir, you can answer some question also. They are asking some.
Someone asked regarding the if someone missed the lecture, so will there be recording? Yeah, there will be definitely recording, and Dr. Tamanna will provide that. We will make actually a group of the participants who are participating in the course, and that will be shared with them.
Yeah, we will make PDF of every lecture, PDF and PowerPoint presentation. So the presentation will be shared in the group. And also the recording, regarding the recording, I will tell you that the recording will be for emergency, like if you have any duty or if you have any sickness, emergency. Because if I tell you that all the class will be provided as recording, so that means we are selling the recording. We are not doing the class, right? Is it not? It is not good actually. So what I will say, try to attend the class, because one day you can be free. One day each class in 1 week. This is not a very big problem. And the thing is, if you are sick, if you are missed due to any reason, just tell us in the group, we will consider it. Okay. Madam, where can we find the written practice exam book? I have just for them. Yeah, from the Telegram channel, you just click my channel name. There is 2 folder, for one for part 1, one for part 2. You can download all the books from that part 2 folder. Okay. And photograph question on cardiac catheterization or data interpretation. Yes, we will teach photograph of data interpretation and catheterization. Yeah, we have a class lecture for that. Okay. Any more question, Dr. Tahir? You want to answer?
Someone is asking regarding the duration and the cost of the course, so you can answer that.
Yeah, so duration will be around 3.5 months, 3 to 3.5 months with exam, mock exam. There will be mock exam. Actually, for course fees, you have to contact us personally, and you have to deal with personal. We have some personal guideline for the fees. Okay, so that you have to follow. And for the course, only one class for 1 week, so it will be very easy for you to attend. You can just take that day leave, because every week we can get 1 or 2 days leave. But even then, if you are working that day morning, you can work in the morning, because our class will be in the evening. Like Bangladesh time, it will be around 7:30 p.m. Pakistan, it will be around 6:30 p.m. So you can join easily. After Maghrib prayer, you can join easily. And we will start our lecture after Ramadan, after the Ramadan is finished. Okay, any more question? Okay, I think if no one has no questions, so we can stop our session here. And please give feedback. And okay, the contact number for the course. So please look at the screen. This is the contact number for the course. Okay, this is my number. You can take the screenshot. Where to get past paper and recall? Okay, for material, I already told you. Material, I cannot distribute you like here and there, here and there. For that, I made a group, that is MRCPCH for Tamanna. Okay, MRCPCH with Tamanna. You can go that group. You can search one by one post, because when I was a student of AKP, I shared my each and every material in the group. Even my hand notes are there. So I cannot give individual people to the notes. If you are enrolled in my batch, you will be in a group, and that group I will share everything. So that will be easy for me. But for 100 students or 200 students, if message me personally, I cannot share you. Sorry, I'm very sorry for that. You have to go through my channel. You have to search every material in that group. Okay. And yeah, there will be no crash course for the May exam, because May is already there. We will start the session in June. So we cannot give you course for May. Okay. And yeah, my contact number is this one. You can contact me for the course or for any trouble you are facing in, so that me and Dr. Tahir, we can arrange another session for you. If you are feeling difficulty in some topics and something, we can give you free lectures for that, because we are always ready. Dr. Tahir and me always ready to help people. But if you are enrolled in a batch, you will be organized. You don't have to ask us, because this is our responsibility. That time you will be our responsibility to provide you everything and notes and every issue. Okay, so but for the free group, we will make some lectures in future soon. Maybe in between Ramadan and after Ramadan, we will make lectures. Okay.
Yeah, someone is asking about how will be the teaching. It will be actually a 3 hours or maybe 3.5 hour session every week. Like, for example, a session of radiology is with me. So how will I do that? So it will be a sort of a PDF lecture, the PowerPoint presentation, and it will the contents which will be there in my lecture, it will be actually from the past recalls. Like, let's suppose there is an X-ray of CCAD or congenital pneumonia, or there is a brain abscess MRI, or there is a tumor MRI in the past papers. So we will take those things, and usually these things gets repeated. Like as Dr. Tamanna said that she had this Wpw syndrome ECG in her exam. I had the same ECG in my exam, and we appear differently at different times. So the things are usually repeating because medicine is the same. It's not going to change. The important things usually common are common, and first, rare are rare, and last. So what we're going to do that we will do the most important things, like in survival guide, in 3.5 hours, it's not possible to go through all the book. But I mean the bottom line of each chapter, like let's suppose the blood. So in blood unit, which things have come in the past recalls? So we will be focusing mostly on that, and that past recalls will be almost 10 to 15 years. So we will be discussing that, and anything at the end of the session, anything else which somebody wants to be discussed, we can discuss that as well. There will be a WhatsApp group in which someone can ask anything and which we can answer. Any one of us can answer that. It will be a 3 to 3.5 months. So I think we will cover everything, inshallah. And Dr. Manna can add.
And also regarding the study materials and regarding the classes, it will be like it will be arranged in a way so that in 1 week you can finish that topic. It will be not overburden you. We will not overburden you, and we will not keep everything for you. Like you read it. No, each chapter will be highlighted. What you should read, what you should not read. This will be highlighted, and If you have any query after that, after the class, you can ask us in the group. Me and Dr. Tahir, sometime we can give some voice note. This is a short lecture, okay? Sometime we can give you hand notes. This will be a short understanding, okay? Like for my part 1 batch, my part 1 students know that I give sometimes the short notes and my hand notes. So this is easy for them to understand. Okay, and for the course, you need not to worry. And for the people who are not in the course, go to my channel, YouTube channel and Telegram channel. You will find everything that is scattered here and there. Collect those things. You have to read those things. And for anything, free lectures, any topic, we will come. Sometimes we will come. Me and Dr. Tahir will come. We will do some topic for you. Definitely, we will do, because teaching is, me and Dr. Tahir both, we have a passion for teaching. He is also a teacher and I'm also a teacher. So giving a lecture for diabetes, giving a lecture for X-ray, ECG, that is not a big deal. So we can do these things when we are free, definitely. And if you have any query for the course, you can contact on my this WhatsApp number. Slowly, Dr. Tahir will give this all responsibility to him also. Okay, first of all, because he's new, so that I am now taking the responsibility. So just join, and if you don't want to join, just you share your experience. How was the class, and is it helpful for you or not? Okay, then Dr. Tahir, anything? We will finish now.
Yeah, Dr. Tamanna, there is a very valid question. Someone is asking that, can we start this course earlier than June, like in the mid-May? I think we can discuss that.
Yeah. We can discuss. Basically, we are making the notes, me and Dr. Tahir also, for the presentation. That needs some time. And as you know, for Muslim, Ramadan is the greatest month for us. And we concentrate on our prayer on this month. That's why I'm taking some time. We can start a little bit 1 or 2 weeks earlier also. Yeah, I will talk with Dr. Tahir and we will have some planning for earlier course. Okay. Okay, anything more? Any question? We will finish now. Tell me in the group, tell me in the WhatsApp how you felt about this session. Was it helpful for you or not?
Yeah, and regarding, someone is also asking about the timing of the session. That will be when we have participants. We will decide that accordingly. We will take everyone's opinion, and then we will do that accordingly. So it's nothing to worry about the time, I think.
Yeah, actually, some people, time is different. Yeah, but we are taking a time that is suitable for you, like it evening. Okay, most of the people do morning duty. Okay, some do evening duty, but like suppose our class will be like Monday or Tuesday, then you can take Tuesday as morning duty, because only 1 day morning duty is not a big deal. Rest of the 6 day you are free. So I think if anyone is really serious about the course, like if you are going to a coaching center or a course for outside the home before pandemic, what would you do? Can you get the class back? No. You have to make your own time for that class. You have to attend the class. So think about seriousness. Think seriously that this is your class. You have to attend the class. You have to leave all your other work behind. Like suppose Monday is your class, you can do Monday morning duty and then evening at our class. Okay, just Monday it will be your busy schedule. Other than 6 day you will be free, like anytime you can take duty. Yeah, you work in a shift manner. Also I work in a shift manner, but I will take my duty other than Monday or Tuesday, like the class I will take duty other than that. Okay, so you have to manage, because if you want only the recorded, then I will tell you that don't join the class, just take the recording and just listen it, I mean with pay. Then it will not be helpful for you, right? So if you join a batch that is a real batch, you will be in the batch. You have to work for us, you have to study for us, you have to ask question. Like we are not here for giving only recording, we are here for the class, and you have to take this class very seriously. For any shift, I don't think one evening you cannot give for a particular course. I don't think that, because suppose I am taking the lecture from England, online lecture for Ghosh or some other society for clinical exam. I cannot tell them that you give me the recording, I will pay you. No, they will not let me do this. They will tell, okay, if you can't do the course, then don't do the course, like this. Because one day if you can't manage, that means you are not responsible for your course, like this. Okay, so try to manage only one day. And if your emergency, like I can be sick, you can be sick, that thing we will understand. If you have any emergency program to attend, that thing we will understand. Okay. Okay, any more question? Okay, I think we have given you a bunch of good information. So what I will say just that, please read attentively, and please, you have any query regarding the exam or regarding our course, please contact this number. Dr. Nadia said, ma'am, I am appearing for May AKP. Is there any way I can provide any classes? I'm really sorry, Dr. Nadia, and best of luck, because you can pass without us even, I think. So you just study hard, okay, and follow our today's lecture. It will be present in YouTube. Okay, my YouTube channel I already give you. This is my YouTube. This channel will contain this lecture, so you can go back to our lecture, me and Dr. Tahir's lecture, and then revise your preparation. It will be helpful for you. Okay, we cannot start before May, actually we cannot start now. Okay, so any more query, or we shall say goodbye and thank you all for joining. Dr. Tahir?
Yeah, thank you so much. And thank you all for participation and being patient and all the way with us. Thank you so much.
Thank you, everyone.